a whole lot more than your right side because you're processing a lot of scientific information. It is often referred to as the dominant hemisphere, and this is for two reasons. One, the left side of the brain controls the right side of the body, and the vast majority of people, upwards of 85% of people, are right-handed. So it is the dominant hemisphere for most of the population if you are right-handed. Another reason why it's considered dominant is because as humans, we like to talk a lot, we may be reading, we like to think we think, and of course we're using the left side for that to do those processes. So important for right-handed control, spoken and written languages, numerical and scientific skills. So this got your English class, your math class, your science class, all on this side. And then of course, reasoning in most people. Now, with our left hemisphere, it's kind of like the sciencey, analytical kind of mind. The right hemisphere is more like the little happy hippie. Okay, so a lot of emotions going on the right side. So it interprets a lot of sensory information, a lot of emotional information. So important in left-handed control, because again, right brain controls the left-handed area. Musical and artistic awareness. So when you're listening to music or you're watching TV, this side might be going crazy, especially if there's a lot of the, looking at the relationship between the images and the music and so forth. So when you're watching Fantasia, this is going crazy. This one is also, when we go along with the musical and artistic awareness, when we're looking at paintings, this is the one that's firing off. You might notice a lot of actors and actresses are left-handed. The theory is people who are left-handed are able to emote better, are able to have better artistic awareness, so they make better artists and musicians and actors because they use the right side of their brain a little bit more because they're lefties. Space and pattern perception. So when you play Tetris, this side goes crazy, or if you're packing a suitcase so you can get everything in, or you're rearranging your living room. So whenever we're dealing with patterning and spacing. So a lot of times if you've done an IQ test, there'll be a lot of, the math questions and the thinking questions. And then randomly it'll be like, what is the next shape in this series? And you're like, wow, thanks for throwing me an easy one. Those are two tests for the right side, because obviously we don't want to say you're stupid just because you're right side dominant. You're just better at Tetris and those kind of things. So occasionally you'll see those pop up. This is also why sometimes it's hard if you're playing something like Tetris and somebody asks you to describe what you were doing. Sometimes it's really hard to stop and think about what you're doing. And sometimes you might die in your little Tetris mode because you're trying to figure out how to describe what it is that you're doing. It's because when you're in those modes, you're on the right side processing. And then if you have to describe what you're letting your Tetris blocks do, you have to pull it from the right side and go over to the left side for the description. And that sometimes causes the brain to compete with itself. So sometimes you can juggle it, sometimes you can't. Your imagination is over there. So when we talk about thinking outside of the box, the right hemisphere is outside of the box. Okay, and that's where a lot of people, if you could daydream for a moment, or you can kind of put things together in your mind visually, that may help you in the long run. So a lot of times, like when we're studying for whatever, we can picture the model, use our imagination to see the model and the parts of the model, how they're related to each other. That's the right hemisphere. All those terms that we're labeling on the model is going to be left hemisphere. So using those sides together will help you obviously to do better on your model work and so forth. Generating mental images of sight, sound, touch, taste, and smell, and comparing those relationships to each other. All that's on the right side. So we're going to do a fun little test. Are you excited? Fun test. Yes.
So if someone is ambidextrous, do they use more of both sides?
Yeah, they'll tag team.
So because you said right-handed or left-handed, use a little bit more of the right-hand side. But if you're ambidextrous, will it be the same? Like if you're right-handed, use a little bit more than left side. Will they both use?
It depends on how ambidextrous you are. So some people are just slight, so they'll go back and forth. Some are almost equal, and then they'll be using both sides roughly equal. That's why a lot of times people who are ambidextrous score higher on IQ tests. They're used to using both sides of their brain interchangeably.
Okay.
Because they have to use both sides to control their mind. Okay. Sometimes that happens. Back in the day, people used to switch to lefties. I was supposed to be a lefty. My parents switched me. Apparently messed up stuff. I was like, you do stuff left-handed. It's like, I don't mean to. It's just my brain.
I have one more question. Let's say you're right-handed, but you were taught by a left-handed person to use your left hand more dominant. Would that activate part of?
Okay. Yeah, because you can train a kid. That's how they switch the left-handed people to be right-handed. They just take the pencil out every time and put it in the other hand, like, no. So, and it sometimes depends on the skills that you use. So like if you were crocheting, even though you might be right-handed, if you're taught by a left-handed person who crochets, you tend to mimic what you see. So you're going to crochet like a left-handed person, even though you're right-handed. And it may not be something you are consciously aware of, but other people who watch hands would recognize that. You become almost like a translator between the right-handed people and the left-handed people with those kind of activities. All right, fun test. Good news, no grades. All right, close your eyes. Don't worry, I'm not going to steal your wallet, so close your eyes. All right, so I want you to picture that you're in an orchard. You're surrounded by big, leafy green trees. The sun is shining. There's a slight breeze. It's warm outside. And these are lemon trees. So when you look up, you see big, ripe lemons on the tree. I want you to reach up and pick a lemon that's right in front of you. So reach up, pick the lemon, pull it off the tree. You can feel the firmness of the skin, the little dimples of the skin. I want you to peel back the rind of your lemon. And you can smell the lemoniness of the lemon, the juiciness of it. And I want you to take a really big bite of your lemon. So who got to taste it? So some people taste their lemon because they've probably tasted lemon before. Some people get the twinge at the back of their jaw because of the big sour things. When I did this way back in the day, I squirted myself in the face with imaginary lemon juice because apparently that's how my imagination works. And my teacher's like, you totally flinched at everything. It's like, oh no, I saw colors. It was horrible. Because my imagination was like, you're going to be blinded by acid. But again, if you're used to using your imagination, you can make it more real. You can get those taste sensations. You can get those puckers at the back. You can get the smell of lemon that fills you. It just depends on how well you are at tapping into the right hemisphere and your emotions and your imagination. So your brain can make things real even if it's not real. So there's our lefty versus righty. So again, the left side of the brain that controls the right side of the body, that's where we're going to have our general interpretive, we're going to have our Broca's speech, our writing, all that's over there. Our right-handed side of the brain that helps our left-hand peoples. Again, this is where we're going to have a lot of spatial and visual analytical skills. So when you're playing Tetris, this part of your brain is just going crazy, or you're packing a suitcase or something. So touchy-feelies, all that kind of fun stuff. So cranial nerves. There's that handout online. Again, it lists the name, the number, the function of the cranial nerve. It's that 2-for handout, so we're learning it for lab as well as for lecture. So it's going to be on the quiz tomorrow. It's going to be on Practical 4 on Monday. It's going to be on Test 5 on Tuesday, Wednesday, whenever you happen to take it. So we do need to know those. The part of the brain that pops out of, again, we covered that as we went through the notes. And of course, we wrote it up on the board yesterday in lab, so you could just write it on that paper. So I could ask you name, number, function, which of these comes from the medulla, that kind of questions. So the brain gives rise to 12 pairs of cranial nerves. 10 come from the brainstem. The other 2 pop up above that. Now they're going to go and supply us with motor and sensory fibers of the head, of the neck, of the shoulder region, and one vagus goes down to your body viscera to help control your heart rate and your digestive activities and so forth. So vagus is the only cranial nerve that if you sever it, it will be fatal. Just like we saw, the only spinal nerve that gets severed that would be fatal would be the phrenic nerve from the cervical plexus. Now, our cranial nerves, again, are always designated by name and number. The number indicates the order. So nerve 5 is the 5th from the top. Nerve 8 is 8th from the top. And then, of course, the name can indicate the function. Ocular motor 3 moves your eye. Okay, so let you know what it does. Or it might describe the distribution of nerve fibers. Trigeminal 5 refers to the fact that that nerve pops out and gives 3 big branches. So that would be the trigeminal, the 3 branches of that nerve. Now, unfortunately, on our model, they cut it off a little stumpy. So you see the wide of the nerve, but you don't see the branching of it, which would make it easier to identify. So know the handout, name, number, function, and the part of the brains they come from. So there he is. And I don't know why they randomly put just one eyeball on it. It makes it look a little weird having just one eyeball. Not as weird as two eyeballs, I guess. So again, we have olfactory 1, optic 2, ocular motor 3, trochlear 4, trigeminal 5. And again, there's those 3 big branches. But on our model, it gets sliced a little low. Abducens 6, facial 7, vestibular cochlear 8, glossopharyngeal 9, vagus 10, accessory 11, and then they chop this one off, hypoglossal 12. Okay, so all those little guys that we can point to on our brain model. And same thing, just super close up. So olfactory 1, optic 2, ocular motor 3, trochlear 4, trigeminal 5, abducens 6, facial 7, vestibular cochlear 8, glossopharyngeal 9, vagus baby, vagus 10, accessory 11, and hypoglossal 12. Ooh, disorders, are you excited? Means the end is near. All right, so cerebral palsy. This is a motor disorder. So it's caused by damage to the primary somatic motor cortex or possibly the premotor cortex, either during fetal life, during delivery, or during infancy. So it can happen during fetal life if your mom contracts German measles or rubella. So they're the same thing. Apparently, German people got offended by calling it German measles, so rubella, essentially interchangeably. This is one of the reasons why they often advocate if a woman wants to get pregnant, she's planning her offspring to be fully vaccinated beforehand, because a lot of those illnesses, you might get it and be okay with it. But if a pregnant woman comes down with rubella in the first 3 months, it can cause cerebral palsy of the baby if the baby survives. So there's also that high chance that she would miscarry because of that. Yes, ma'am.
Are those the same measles that's currently going on?
Now, the normal one is the measly measles. Probably also why they've changed the name to rubella from German measles. So yeah, the one currently going around, if you're going to get the rash, the big fevers, the bumps all over the place, it can be fatal to small children. But adults usually just have measles for a while and they go over it. The downside with measles is it is one of the most easily contracted diseases out there. And you are infective for weeks. So a lot of times if you are exposed to or have measles, they ask that you stay home for at least 21 days. It's like, oh, you're out. So it's more infective than something like COVID would be. Why are you supposed to get your kids vaxxed?
Is this similar to chickenpox? Rubellum? No? Is the regular measles no? Okay.
Yeah, the only thing that's similar between those two is red rashes. But with chickenpox, you'll actually get the blistering, the poxes.
What was the other one that's similar to chickenpox?
Herpes. Genital herpes, cold sores.
What was that other? You said it was like
Shingles.
shingles.
Shingles is just the adult version of chickenpox.
Okay.
So that one can also be fatal to babies, but just completely different.
Hmm.
Now, this can also happen during birth. Again, if there's a head injury as the baby's coming out, if they don't get enough oxygen to their brain and you have brain damage from lack of oxygen, that can cause this. So for a while, you used to see this on commercials, like if your kid has cerebral palsy, sue their doctor. During infancy, unfortunately, the primary somatic motor cortex, that central gyrus, is right below the anterior fontanelle. So if you land on your head or dent too hard, that can damage the brain underneath it, causing the cerebral palsy. Now, with cerebral palsy, since it's damage to the motor areas, we'll have partial paralysis to complete paralysis of the voluntary muscle. So they still have reflexes. You wouldn't be able to control them properly. So you would either have the weaknesses or partial control or just none at all. With cerebral palsy, again, it is irreversible. Once we have brain damage, it's brain damage. You can't fix it. So it's something you're going to have to live with the rest of your life. Now, 70% of cerebral palsy victims appear to be mentally delayed or impaired, but they're not. And part of the reason why they appear mentally delayed is because a lot of times we judge people based on their speech, right? So if we hear somebody who talks like a redneck, we automatically think they're kind of stupid. Yeah, we're looking at that alligator hunting show on History Channel. We're like, yeah, you guys just need banjos and you got to go. With cerebral palsy, if we damage the area of the face, we're not going to be able to talk correctly, even though the Broca's speech is completely fine and the thinking areas of the brain are completely fine. But if you can't control your face and your mouth, you're not going to have normal speech patterns and articulations. So they may have slurred speech, they may sound drunk, with the way they're talking. They may not be able to talk very clearly. And unfortunately, as humans, we tend to judge, and we judge, oh, they can't talk, they must be stupid. So it has nothing to do with the thinking areas of the brain. It only affects the motor areas. Yes, ma'am.
Do they have like this, do they live a shorter life or they just live like a regular?
They're normal. They're just like a paraplegic can live a normal life. So they're just going to have problems with movements.
So they can't get like face surgeries, like poked in the face or something to like try to fix it.
No, because it's brain damage. You might be thinking Bell's palsy. So Bell's palsy is a problem with the peripheral nervous system going to the facial muscles. So that often happens after certain over responses to diseases or vaccines where your body attacks the neurons in your face. So that one, the shots are going to help you with because it's not a brain problem, it's a motor neuron problem. So different target place. But they would appear similar because you're gonna have facial paralysis. But this one's no way to fix it. Multiple sclerosis. This is a disease of the central nervous system that is a combination of a loss of the myelin sheath. So if we lose the myelin sheath, we're gonna make those neurons go from 300 miles an hour or 40 miles an hour to 2 miles an hour. So that's going to slow their ability to fire, receive, and send neurotransmitters. And then we also have the development of scar-like patches. So it's kind of like back when they had all the construction on I-40, not only did they drop the speed limit down, so it took forever to drive down I-40, but then sometimes you had to do a detour off and then stop at a stoplight and then get back on. It takes forever. That's what happens here. By slowing down the neurons and their ability to fire, plus putting scars there, so you have to have the neurotransmitters float around scar tissue, it's going to severely slow down how these neurons function. And that could cause issues with numbness and tingling if it's hitting around the sensory areas. It can cause problems with paralysis, muscle weakness when it hits around the motor areas. So we have this impulse transmission interruption that is going to prevent us from properly communicating with our body, controlling our body. Now, the onset age is usually between 20 and 40. Now, there's a lot of theories about what causes multiple sclerosis. Sometimes it may be caused because of somebody having an illness. Any way we look at it, the multiple sclerosis is considered an autoimmune disorder. Your immune system has attacked your nervous system and is destroying the myelin sheath and causing that scar formation. So some people suspect that certain diseases could lead to multiple sclerosis because when the body over-responds to this disease, all those extra cells that are done fighting that disease have nothing else to do, so they start killing something else. It's like, a riot or something after something major happens. So some people say there might be contributing factors with certain kind of diseases and how the body responds. There's also genetic factors. We have found that females get multiple sclerosis more than males, usually twice as much. And anytime you have one sex getting something more than the other, there might be that genetic component. So we don't know if there's a genetic weakness there, a vulnerability, or there's just a gene that's causing this to get turned on and cause the autoimmune disorder to happen. So again, they're still researching it. Now, the downside is the early symptoms, again, is muscle weakness. And of course, unfortunately, between the ages of 20 and 40, muscle weakness may also just be, wow, I'm tired today. I'm having a crappy day. So some of those very early symptoms may be missed by doctors, misdiagnosed as, oh, that's fibromyalgia, you just have tiredness, you need to get better sleep, blah, 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 or it could actually be this issue. You do have to have a blood test to see if you have the excess antibodies to confirm that you have multiple sclerosis. And unfortunately, some doctors are like, nah, you're fine, just plug it in. So with this one, it's important to diagnose it and start treating as soon as possible, because the sooner you're able to treat it, the less we destroy the myelin sheath, the less scar tissue we have, the better likelihood, better quality and quantity of life you're going to have, because you're suppressing any kind of damage. Death from this guy from onset can be anywhere between 7 to 30 years. Okay? It depends on your treatment. If you are very active with your treatment and you're taking immunosuppression medication to prevent further damage, you're going to have a longer quality of life. You're not going to have paralysis as early on and problems that way. And if you're treating this with, eucalyptus oil or something weird like that, you're probably going to go through the symptoms much, much faster. And of course, you kind of have that perspective. If you're diagnosed at 40 and you live another 30 years, that's in your 70s. That's a pretty good run for most average people. Unfortunately, if you're diagnosed in your 20s and you live 7 years, not a good run. Okay, so it all depends on how soon you can get diagnosed, how quickly you can get treatment in, and what type of treatments, aggressive treatments, often do better to prevent the damage. A cerebral vascular accident, because nobody plans to have one of these things. They're also called a stroke or cerebral hypoxia. Hypoxia just means lack of oxygen. So you've got a blockage that is preventing blood from getting to the target cells of the brain. And this blockage could be a hemorrhage, because if you're bleeding over here, obviously the blood isn't getting to where it's supposed to go. This could be a thrombosis, a blood clot. That's preventing blood from getting past that clot area. This could be atherosclerosis, so fatty plaques from buildup of high cholesterol. So if we block the blood from getting to where it needs to go, those cells start dying from lack of oxygen, lack of nutrients. And that's the major characteristic of having a stroke, is that you have cellular death. And that's the deciding factor. Did you have a stroke or a mini stroke? If you have a full stroke, you will be able to see brain damage on CAT scans. So you'll see parts of the brain that have just died off and kind of shrink away. If you don't have any brain damage that's picked up on the scan, then you just had a mini stroke. So you survived it, and hopefully you don't have one over the next however many years. Now, this is the most common brain disorder that you have out there. So you're more likely to have a stroke from anything else. And of course, it can be fatal depending on what part of the brain it hits and how severe that brain damage is. And the downside with this, there's always the initial damage, the cells that died from lack of oxygen. But when those cells die, they start leaking cellular materials, like being by a rotting corpse. That's going to make other cells adjacent to it sick and can kill other cells. So it's very important to get in and hopefully get those macrophages in there, cleaning up the messes as quickly as possible before we have additional cellular death. So this is why when somebody has a stroke, usually they'll tell you, we're going to give it a few days to see the extent of damage. They want to see, we have the initial cell death, but how many cells are going to die because of the surrounding guys? So it may take a while for all of the results to be in. How much paralysis, or did you go blind, or you have this problem, that problem due to the stroke. It depends on which part of the brain was affected, what kind of symptoms we would have. Epilepsy, second most common brain disorder. So this is a misfiring of the brain. So you could be releasing more neurotransmitters than you're supposed to, or you could be releasing less neurotransmitters. So some kind of disruption to normal transmission of those neurons. Now, of course, if it happens in the motor area, so that's where the epicenter is of that epileptic moment, then you'll get those convulsive seizures because we're happening in the motor areas, causing misfiring and muscle contraction. If those happen in the sensory areas, we can have loss of consciousness. So you'll have people who are epileptic who know how they have seizures because of where they're located. So they're like, oh, in a minute, I'm not going to be able to see anything or hear anything. Just put me to the side and make sure I don't hurt myself. The eyes shut down, the ears shut down because those areas are misfiring. So we can't process sight, we can't process sound. So depending on where that hits, we may have sensory issues, loss of consciousness, loss of sensing coming in, processing it. We may have motor area problems. Now, very rarely does it happen in the thinking areas of the brain, so it very rarely affects intelligence. So if you're epileptic, it doesn't mean that you're going to be smarter or stupider than the average person, because it's not going to affect those areas. It usually just affects the motor sensory areas. Alzheimer's disease. So when you have Alzheimer's, you end up with a shortage of acetylcholine. And if you don't have enough acetylcholine that the neurons aren't releasing, if they can't catch acetylcholine, they don't get stimulated. If you don't stimulate them enough, they start dying from lack of use. Okay, so eventually, once you have cellular death, that's going to cause the gyri to shrink. That's going to cause the brain to shrink. So you are going to have structural changes of the brain that are noticeable. And again, that's how they can confirm a patient has Alzheimer's. They can look at the brain and go, this part's smaller than it's supposed to be. That's an indication that we've had massive cellular death in this region. Now, this is oftentimes associated with the frontal lobe, especially the prefrontal area. So this is why we have those changes to the person's cognitive ability. So you don't usually see physical problems or sensory problems because of the area of the brain that's affected. So once we start losing neurons, once our gyri start shrinking, you can't go back. So you can't ever fix Alzheimer's or cure Alzheimer's. The damage is permanent. all you can do is slow the progression of the disease and prevent further disease. And a lot of times the treatments would be supplementing acetylcholine, giving them neurotransmitters to help keep their neurons firing and receiving information so the cells don't die off as quickly. So again, irreversible. It will result in dementia because again, we're losing our cognitive facilities because of our prefrontal area, frontal lobe shrinking upon us. Intellectual impairment, personality changes because that prefrontal works with the limbic system. So this is where you get the angry Alzheimer's or that become combative, or the sad Alzheimer's, people that just cry a whole lot, that kind of scenario. Eventually it can be fatal. The brain will shrink to the point that it doesn't function properly. Again, back when we had Cadaver Lab, we had a lady who had Alzheimer's. She died from a heart attack, but her brain, it looked like someone just shoved in the front of it because it had shrunk so much, it was almost like the frontal lobe wasn't there anymore because severe Alzheimer's disease. Now, Parkinson's disease, both of these diseases have acetylcholine issues. With Alzheimer's, you don't make enough of acetylcholine. With Parkinson's, you actually can make too much. So this is where treatment becomes kind of crucial, because if you have Alzheimer's, you can give them acetylcholine, and that's going to help stimulate the cells to lessen the effects of Alzheimer's. But if you give them too much acetylcholine, it could trigger and cause Parkinson's disease. And you don't want to cause one disease because you're fixing another. And again, with Parkinson's disease, we have too much acetylcholine. You don't want to give them a blocker that prevents acetylcholine activity, because if you overblock acetylcholine, that can cause Alzheimer's disease. So you do have to be very careful, because the treatment of one can cause issues or symptoms similar to the other, because one has too much acetylcholine, one has too little acetylcholine. Now with Parkinson's, it's often described as occurring mostly in older individuals. But again, we see more and more people diagnosed. Michael J. Fox wasn't very old whenever he was diagnosed with Parkinson's, but it's still typically an old person disease, but you can get it as a younger person. When we have the Parkinson's, we overstimulate the muscles, causing muscle rigidity because they overcontract, and tremors because they're overcontracting, causing those tremors. This is due to problems in the midbrain and the basal nuclei. The big area is the basal nuclei that has the issues. Now, the cause is unknown. So this is an unfortunate thing, because if you don't know the cause of a disease, you can never cure the disease, you can never fix the disease. All you can do is manage the disease. So anytime someone says, oh, we're trying to come up with a Parkinson's cure, yeah, good luck. You got to figure out what causes it first. And we don't know that. So you can't cure something if you don't know what causes it. All you can do is manage and manipulate those symptoms and try to prevent it from progressing as quickly by supplementing those neurotransmitters the way we need to. But you can never cure it or stop it, because we don't know what it is to cure or stop. We haven't seen any evidence that shows that it's hereditary, so it'll just randomly appear in families. Just because your parents have Parkinson's doesn't mean you get Parkinson's. It was suspected Muhammad Ali had this because he got hit in the head too much. Totally plausible, right? Michael J. Fox, there was one theory that was, well, when he worked on Family Ties, he was down the street from this electrical factory, and the emissions coming from the factory caused it. And they're like, yeah, we don't have proof of that either. So no one really quite knows how it gets going. All we can do is try to manage those symptoms. So the early symptoms, the cells in the basal nuclei stop producing dopamine. So within the basal nuclei, the dopamine basically pumps the brakes on your muscles. So your brain is telling you how to contract. The dopamine from the basal nuclei says, yes, contract, but don't do so much that you cause a tremor or you become too rigid. So early treatments of Parkinson's is to give them levodopa, give them dopamine in this medical form. That way we can slow down the progression of the disease and the effects of the disease. In the later stages, the patient can also produce too much acetylcholine, which overstimulates the motor drive, which overstimulates the muscles. So you have two issues with the neurotransmitters, both dopamine issues and acetylcholine issues. Yes, ma'am.
Is it just to treat or calm down the tremors with marijuana gummies?
So, so marijuana is a downer. Okay, so anything that's going to be a downer can help with relaxing of muscles, because it suppresses the release of acetylcholine, which is going to slow things down. So you definitely don't want to do marijuana gummies if you have Alzheimer's. That'd make it even worse. Okay, so anything that's a downer. You could drink alcohol, it's gonna help. Not that anyone's gonna prescribe alcohol. You should get drunk. That'll make it better. Because you can lose cells too much of it. So. Yeah, that's always the funny thing. It's like, oh, marijuana, it's the ultimate cure. No, it's not. It just slows things down. So it suppresses the release of neurotransmitters. Downside, kills brain cells.
Like even I thought the killing of the brain cells was like the inhalation of the smoke.
Which has the chemical that is the active form of marijuana.
So even edible can kill, but that's crazy.
Yeah. It's one of those, there's not as many studies to show the damage that marijuana, because you always hear that, it's like, well, marijuana isn't as bad as cigarettes. We have hundreds of years of studies about what tobacco does to you. Marijuana, people have been hiding it up until recently. So we don't have any medical studies that really show what marijuana does to your brain and body because no one admitted to it. Okay, so if you think about it, if drinking causes fetal problems and smoking causes fetal problems, of course marijuana is going to cause fetal problems. It changes the chemicals in your brain, it floats around in your bloodstream. You can actually pick up traces of marijuana in breast milk up to 7 days after one joint. So it, of course, is going to affect your baby. I have one of those neighbors. So many of those neighbors are cool meth heads. They're like, my baby was so calm. It's like, you're high. Of course your baby is calm. He's high too. And they're like, he was the best little baby. He was always so quiet. Baby be high. And that poor little 4-year-old kid's running around slurring his words. It's like, oh yeah, marijuana's completely safe. That kid's messed up. He's in special ed for who knows why? Oh, well, that's a mystery, isn't it?
So do you think there's another chemical that's similar to THC? It doesn't have the THC in it. I can't remember what it's called.
Delta 8.
No, it's like for medical uses. They use it for. It doesn't have any effects of marijuana, but it has certain chemicals of it that help slow things down. What do you think?
So it doesn't cause the tripping that people get, but it does have the effects of suppression of release.
Okay.
So like miracle grade marijuana is bred not to make you trip out, but to release enough of the chemical to suppress the activity.
And can that still destroy cells as well?
If you take too much of it, too much of any drug is going to be bad for you.
Right.
Anybody that tells you any different is trying to sell you that drug. These are completely harmless. Sure they are. Go ahead, eat 20 of them right now, see what happens. Yeah, so anything can cause damage over time. Especially something, if it can cross the blood-brain barrier, you know it can cross a placenta to get to babies. And if it crosses the blood-brain barrier, it can change the function of brain cells and eventually could cause problems with brain cells. Look at stoners in their 40s, listen to them talk. You're like, something didn't work right. It went in, it stopped. And again, all it does is lower. So people who take it for glaucoma, you can take blood pressure medication, does the exact same thing marijuana does, but it doesn't cross the blood-brain barrier. So it's just an excuse to smoke marijuana. Right, we've all heard the whole, marijuana helps with glaucoma. Lowers your blood pressure. Ever seen a stoner stress out? Not unless they lost their legs. Okay, so they're calm. Relax. Anything that calms you, relax. Of course, you don't want to do marijuana and drink a monster. Calm, not calm. They'll counter each other.
So will they cancel each other, or will you just have symptoms of both, like kind of like bipolar symptoms?
You would have a fun day is what you're gonna have.
Wow.
The walls will be melting. It'll be great. It depends on the dosage. Who wins? But you'll have issues with both of them firing off in the brain. Yeah. Gotta be watching out for those little guys. And you can't double down on downers, right? Then it kills you. You stop breathing. That's why you can't take barbiturates and alcohol. You stop breathing. You smoke pot and drink alcohol. You can stop breathing.
Wow.
So don't double down on things because your body's like, I'll just stop this right now. And then it does. And then you die. Right? Become a part of the 27 Club from the Hollywood.
27.
A lot of actors die around 27, usually from drug and alcohol overdosing or shotguns. Cobain. He was high. Anywho, so don't do drugs, kids. Messes up your brain. All right. So how do we fix this? Try to fix this. Of course, you can give them levodopa. You can also do surgical destruction of the brain. It sounds really weird, but you can go in and suck out the basal nuclei. Problem solved. This stops bothering you. It doesn't completely cure the disease. It basically acts as a reset button. So you can take somebody at stage 3, do the surgery to their basal nuclei, which basically separates the basal nuclei from the rest of the cerebrum, and it resets them to stage 1. So it doesn't completely cure them, but it buys them a few more years, so they start over. So they're not as tremor-ary as they used to be. And it works on a lot of patients, but some patients it does not. We're not quite sure why removing part of the brain doesn't work, but it doesn't work on all the patients. And it depends on the stage you're in, how successful that working will be. Don't do drugs. Huntington's disease, this one is hereditary. So you can test for it if you've got the gene for Huntington's, if it's something you can have or pass on to your kids. Now, you tend to have the same results as Parkinson's. It's going to affect the basal nuclei, starting to destroy and disintegrate the basal nuclei. So you're going to get tremors, you're going to get overstimulation of the muscle drive. The big difference is with Parkinson's, it tends to stay with the basal nuclei. With Huntington's, once it takes out your basal nuclei, it spreads to the rest of the cerebrum. So it will be fatal fairly quickly once it gets going. Transient ischemic attack, a TIA on the street, this is a mini stroke. Okay, so this is where you have a temporary cerebral dysfunction due to impaired blood flow. So you don't have 100% cutoff of blood to that area. Maybe you're at 50% or 75% cutoff. So we're getting less oxygen, so we start to have symptoms of lack of oxygen, lack of nutrients, but not to the point the cells die. And again, that's that major determining factor, how a doctor can diagnose if you had a stroke or a mini stroke, because your symptoms might be exactly the same. You might have had paralysis, you might have collapsed, you might have had severe pain in your head, and then they go and do the brain scan. If there's been damage, stroke, no damage that's been picked up, then you just had a TIA. You have a preview of what a stroke can be. For most people, the attack lasts about 5 to 10 minutes before that blockage gets cleared through. In severe cases, it can last up to 24 hours. Depends on how big the blockage is and what's causing it. Now, it's estimated about a third of patients who have a TIA, a mini stroke, will have a major stroke within 5 years. Because, of course, if you've got partial blockage of a blood vessel today, there's a good chance if you keep doing what you've been doing, it's going to get fully blocked. So after people have a TIA or even a real stroke and survive it, they're going to be put on blood thinners like Plavix. They can be put on blood pressure medications, cholesterol medications, trying to prevent the stroke, because again, that stroke can be fatal, where the TIA is just temporary. Amyotrophic lateral sclerosis, we talked about this on test 4. So this is where we have destruction of the anterior horns of the spinal cord. So wiping out the somatic motor neurons going to the skeletal muscles, as well as the destruction of the pyramidal cells. You'll have the cells of the primary somatic motor cortex start dying on you. So you'll have brain damage as well as spinal cord damage. And of course, we're going to get a progressive first weakness of the muscles, and then a paralysis of the muscles. And towards the latter stages, you lose the ability to swallow, lose the ability to talk, you lose the ability to breathe. So the only way to survive is to be on a mechanical respirator. And then, of course, have the supplemental medical care that, a feeding tube and a nurse to take care of you 24/7. So your survival is basically based on your money. So Stephen Hawking had this. He lived for quite a while with this condition because he had a lot of money. He was rich, so he was able to have a portable mechanical respirator breathe for him and the best high-tech wheelchair and all that kind of fun stuff. It also shows that it only affects the motor areas because he was still the smartest dude in the world. He just had to blink out all his physics problems. I just always think it might be kind of funny if you got like dust in his eye and he's trying to talk but blink at the same time as the dust in his eye. Because that's how he communicated in the last stages, because he couldn't move his face. He'd blink out messages, and a little computer would read his eyes and tell you what was going on. But again, super rich, so he could live for a long time. Most people who are not super rich live about 2 years, because after all, insurance is like, and pull the plug. We're not going to pay for this anymore. Anticephaly, this is something that happens to babies where they're born without a part of their brain. It might be the mesencephalon, it might be the diencephalon. So again, without the thalamus, we're gonna have problems with sensory and motor output. Without the hypothalamus, you're not gonna be able to regulate sleep and eating and drinking and hormones. Without the mesencephalon, the midbrain, you're not gonna have the ability to allow information going from the upper levels of the brain to lower levels of the brain efficiently. So this is fatal. You're not going to be able to survive it. This is one of the reasons why they do the 5-month sonogram. So a lot of people assume the 5-month sonogram is so you can pick the name and the paint color of their room, but it's to make sure all the pieces are there. So at 5 months, everything's big enough you can see. So you can see if they have a brain disorder, you can see if their heart is misshapen, if they've got a heart or congenital problem that way. You can see if their digestive system's on the outside. It's rare, but it happens. They have to do surgery to stuff them all back in. You can see if they have spinal bifida, that kind of scenario. Now, unfortunately, how you feel about it, the baby appears completely normal. So if you don't have that 5-month sonogram, if you didn't know your baby was missing a part of its brain, you wouldn't think anything of it. They are going to eat and drink and lay there and blink at you, just like other newborn babies. But it is not survivable. Most of them die within a few hours to days to months after delivery. The longest I've heard of an anticephalic baby surviving was 2 years, and the baby lived at the hospital. So they were on life support the entire time under medical care. It could not live on its own or do anything on its own. And it was finally the parents were like, okay, we're ready to let go because the kid can't survive anymore and the poking and prodding and stuff like that.
So is this similar to SIDS? Or is
So
it
with
SIDS?
SIDS, we don't know why the baby died. It just died. Usually because they haven't used their medulla very often, so the coordinating of breathing is a little hard for babies because they've got to learn how to do it. But when your baby dies and you don't know why, that's why they always do an autopsy. So if they do an autopsy and they find out they have anticephaly, that's the cause of death. SIDS is, it just died. We don't know why. So most often it's usually a misfunction of the medulla talking to the phrenic nerve. Yes, ma'am.
Is there any other reason why a baby would be born with like little bit part of their brain missing?
Usually it's just a developmental defect. So there's lots of reasons for those. It could be a genetic defect. It could be the cells didn't divide like they were supposed to. And this can happen as early as, 16, 24 cells in if we don't divide properly. A disease that could cause neurological damage, stuff like that. Anytime you're missing stuff, that actually happens very, very early on in the first trimester. So we just don't know about it until it's big enough to see all the bits and pieces. You make all of your organs starting around day 16, and all of your organs have completely formed by the time you're a fetus, which is why your OBGYN doesn't want to see you until you're 9 weeks in, because if you're going to miscarriage, 80% actually happen very early on. Even though people think babies are no, that's pretty rare. 50 to 80% of pregnancies end in miscarriage, often before mom even knows she was pregnant, because of a genetic or a cellular defect. So full-term pregnancies are actually still miracles if you look at the odds of survival and stuff.
You said 50% or more?
50 to 80% pregnant because the baby dies before they even stop a period. So that's where sometimes you'll get the false positives where it's like, oh, my pregnancy test, I said I was positive, I'm pregnant. And then a week later you have a period, you're like, oh, I wasn't. Yeah, you were, you just miscarried.
Oh my gosh, that's crazy.
Hands are up everywhere.
Wow.
I don't care which one of y'all want to talk to me first.
So, if you got you had a really fun time the night before you got pregnant.
Yep, good weekend. Yeah.
Would all that you drank and stuff, would that affect the baby?
No, baby runs on its own power source. It has a yolk. It doesn't start building a placenta until day 11. So you actually have about 2 weeks of fun time before whatever you do does something to your baby. So you don't have to worry about, wow, I think I got knocked up at that crazy party. Your baby's okay. So again, at 9 months, all nutrients come from you and that placenta. But up until that point, a lot of the nutrients are coming from the yolk sac, especially very early on, because again, we don't even build a placenta we start building the placenta on day 11. And then it has to hook up properly and have all the blood vessels and so forth. So you're looking into week 2 and 3 when it starts to siphon off of mom. So you're good for a little while. Miss the period, good time to stop partying.
So the baby will just like come out like anytime, like whenever you're using the restroom, or how does that happen?
So it depends on how far, if you were just a few cells in, a couple of weeks, you're microscopic. So your body's just going to reabsorb it. You'll have macrophages that eat it. If everyone's like, it's less than the size of a period, it's okay. It's the same thing that happens if you inhale a bacteria and your body attacks it in your nose. Same scenario. If it does get to the point that it implants, when you have your period, it's all going to come out. So early miscarriages, body reabsorbs, you'll have a period. Anything that doesn't get reabsorbed comes out with the period. If you are further along, so you're 4 months in, 5 months in, you're going to have to do a D&C. So they're going to have to go in and clean you out and pull it all out. So depends on the size, if it's going to be noticeable.
Once they have to go in and like clean out, would that be considered an abortion or?
So if you've already miscarried and you just have tissue there, it's not considered an abortion because it's not alive anymore. So that's why they call it a D&C instead of an abortion. Now, if the baby's still alive and you do a D&C, then yeah, it's an abortion. There's a fine line. One's dead, one's alive.
What is DNC?
Oh gosh, now I gotta remember what the whole word means. Basically, they got a tool and they scrape you like a pumpkin.
It's something in cured
Yeah.
Oh, okay.
Dang.
I was
gotta look
thinking
up
something
DNC.
similar to like do not resuscitate as well.
Yes, but down there.
DNC.
No, they have to go in and scrape away the tissue and suck out any chunks too big to pass.
So basically, you could like mistake like your period for a miscarriage.
If it's early enough, yeah. Because again, even at 9 weeks, your baby's the size of a grain of rice. So if you miscarry at 9 weeks, even though it's a full little fetus that you can see on a sonogram, when you miscarry, you're going to have a period, and it's just going to come out with a period because it's only about that big. It's usually not noticeable until baby's closer to 3 or 4 months, and then it's bigger size.
Wouldn't it be more painful though? Like at 9 weeks, it wouldn't feel like just a normal. No, it would just
Be a normal period.
It's crazy.
Can those like miscarriages, could those be hereditary from the mom's side, or it's just like?
There's a mom's fault. That and balding, we're gonna blame her for everything. There's debate with that. One of the big things that can cause problems with pregnancies is if women have polycystic ovarian syndrome. So with that condition, you don't make enough progesterone, and if you don't have enough progesterone, you will miscarry. So some of the medications that prevent you from miscarrying early on is shots of progesterone. So if you're on a progesterone supplement, you won't miscarry as quickly, or you may be able to carry full term. Now, some people suggest that that condition might be hereditary because you'll see it in families, even if it's not fully, personal. My family. So my mom had 9 miscarriages. And she had severe, like hers would rupture and then she would have soak through a chair periods. So she had severe issues. I've never soaked through a chair. I'm sure glad of that. Me too, because chairs. But I do have polycystic, but I apparently have a mild case because I'm not bearded or anything like that. But I did have to have help to ovulate to have children. But once my uterus got going, it was like, sure, I can handle pregnancy. So I didn't need any progesterone supplements. I have a cousin who had to have her ovary scraped in 11th grade because she had so many cysts. So there's a lot of that popping up in the family, but to date, they haven't put anything to paper to say, we have this genetic component that is linked to this condition. So if your family is a carrier for this condition, you're more likely to have these female problems. And that's in part because for the longest time, they were just female problems. But now we're doing a lot more research, like the polycystic has now been elevated to a metabolic disorder instead of just a reproductive disorder. because it can change how your body uses insulin. So a lot of women will get diabetes from it. It changes how your body processes fat. So they'll actually show a lot of women who don't have it regulated, even if they don't get diabetes, will get fatty liver disease because they process fats differently. And that's why they have issues with weight gain and things like that. So they have shown that it's just not an ovary problem. It's, oh, look at that. Estrogen doesn't play well with insulin, and then you get the diabetes, or estrogen doesn't play well with your thyroid hormones, and then you get the weight, and then you get the fatty liver disease. We're finding out that all these hormones are way more linked than we used to think. We used to just think, well, now she can't get knocked up. Now it's, well, now she hasn't eaten some liver transplant or something along those lines. So we're learning more and more because people are interested in women problems now instead of just calling them women problems. And once we get more, it's kind of like breast cancer. We didn't know it was a gene thing until fairly recently. So it might be something that the more research they do, they may see a linkage with genes, which would mean that it's a hereditary problem. There's a few breast cancers that are linked to genes. So when you're listening now to like the breast cancer treatments, they say if you have this letter designation, that's usually the breast cancer gene. It became real popular, not the gene, but the knowledge of it. Angelina Jolie has the breast cancer gene, so she had a double mastectomy so she wouldn't get breast cancer. You're like, really dramatic much, aren't we? But it's one of those that you can be tested for that. So there are those certain cancers that are genetic. We're finding out breast cancer, some of them are genetic, some lung cancers are genetic. So the more we research, the more we're going to find. So.
Progesterone, for some reason I'm thinking a steroid. Is it similar to a steroid?
Yeah, so steroid is just a collection of hormones that have a fat chaser, a steroid on it.
Okay.
That's going to include estrogen, progesterone, testosterone, glucocorticoids. So your stress hormones are steroids. That's why you get a steroid shot when you have a runny nose to stop you from being snotty. It suppresses the immune system. So it's not a shot of testosterone. It's a shot of glucocorticoids that will suppress your immune responses. So that's the steroid shot you get, and then you get the antibiotics for 2 weeks afterwards. So it tells you to sit down, shut up, and take it, and have some antibiotics while we let the thing try to kill you. Yeah, so steroids, it's just a wide family that have a steroid fat attached to it, which basically gives it a backstage pass to get to the nucleus and alter the nuclear activity. So that's how steroid hormones work, is they change how your DNA works. So that's why they cause so many problems. A&P2, feel free to take me, where all of this will be a part of your lecture test material. You're just getting it early. Now you know who to avoid or not. I do have spaces in my A&P2 class, just saying.
For the fall?
For the spring dose. I have A&P2 at 9 o'clock in the morning.
Spring.
Currently have 18 people registered, so
Spring of next year?
spring of next month.
Oh.
Spring dose. I'm sure I'll have openings next spring too.
I thought we were
fire.
in spring right now.
We're in spring 1.
Oh, okay.
Spring 2 starts after spring break.
You have openings for your.
I do. See, you already know the crazy. I don't have to relearn somebody else's crazy, because we're all crazy. Oh, look at that. Speaking of crazy, not really, but Reye's syndrome. Reel it back into the brain. So Reye's syndrome. This often occurs after a viral infection, not usually because it's the virus causing it. It's because when you've got the flu, when you've got chickenpox, you feel like crap, you've got a fever, you take aspirin. Aspirin at normal doses is what causes Reye's syndrome. So that's just 2 pills every 6 hours for 24 hours that can give you Reye's syndrome. And again, the reason why this one is so problematic is because aspirin is small enough, it can cross the blood-brain barrier. So it actually talks to the neurons in your brain directly to make your pain go away. Tylenol and Advil can't cross the blood-brain barrier. So they affect the peripheral nervous system to tell them to stop telling your brain that your body parts hurt. So since this one can cross over, it can cause direct damage to functionality and to the neurons, killing the neurons. Now, the majority of people who get Reye's syndrome are usually children and teenagers. It's not an age thing, it's a size thing, because we all know on dosages, whether it's Tylenol or aspirin, it's 12 and older. And most of us were much smaller at the age of 12 than we are today, okay? So medical dosage, pill dosage, this is just like alcohol, right? If you're skinny, you're gonna get drunk faster than if you're fat. So if you are a 12-year-old and you're barely 100 pounds, you're going to have a high amount of drugs in your system, even just taking 2 pills, where that same 2 pills in a 160-pound person isn't very much medication. So again, it's just like bigger people who drink more alcohol before they get drunk. This is characterized first by vomiting. That's the medulla saying, I'm toxic, I need to get rid of it. Unfortunately, a lot of people miss the first symptom because it's like, I have the flu, I'm sick, I have a fever, and now I'm vomiting. They think it's a part of the original problem and not a new problem that has developed. And of course, we have brain dysfunction as cells start dying, and liver dysfunction as the liver tries to filter out the toxic level of aspirin.
So what if you're taking aspirin with an anticoagulant? Are you at a higher chance?
So aspirin for, St. Joseph's, or you take baby, you eat 81 milligrams. The pills for over-the-counter Bayer aspirin is like 100 and something. So your 81 is much smaller. So it's less than your normal. And you're only taking 1 pill a day versus 2 pills so many times a day.
Would you recommend staying away from aspirin for children?
I personally would. Again, I am not a medical doctor. Do not seek me for medical attention. Don't blame me if you die. But it's one of those, that's one of the reasons they have children's aspirin versus adult aspirin. It's lower dose. So it should not run as much risk. But me as a parent, I never kept aspirin in the house until I got older. And my mom's like, take it for your blood pressure. You need it. Thanks. Okay. But I've never given my kids aspirin. It's always Tylenol and ibuprofen. Well, it's always ibuprofen because I'm allergic to Tylenol, so I can't keep that in the house. So it's one of those things that it won't cross the blood-brain barrier, cause problems.
Okay.
That's a personal choice. Dyslexia, dys means difficult, so when you diss somebody, it's difficult. And Lexus means words, so some people drive really expensive words around town, right? There goes Alexis, it's a word. So it involves the inability of an individual to comprehend written language. So this is often a problem with the general interpretive area. It's misdiagnosing this letter for that letter, or this sound for that sound. So most of us are aware of the classic dyslexia where the letters are upside down and backwards. So God looks like dog and P's look like Q's and all that kind of crazy business. That's not all the types of dyslexia. Some people who are dyslexic, their letters are normal, but the words get jumbled when they read. So whenever they read a normal sentence, to them, it's almost like listening to Yoda talk. It's all weird unless you rearrange the letters. So there's lots of different types. So a lot of times it's behavioral treatment. So you teach them how to study, how to cope, different mechanisms. There are some physical therapies, glasses. So you can get either rose-colored glasses or like a baby blue-colored lens on your glasses, and that can help with some people with dyslexia. It doesn't help everybody, but it helps some because the color change is enough to weird out the visual component. That might help them out a little bit. Questions about that stuff? All right, let's tiptoe into this because we're never going to get around to a review. You guys are just so excited about learning. Stop that. All right, so the SNS chapter. Of course, in order for us to move our body, we have to feel our body. We have to have sensory things. Now, the peripheral nervous system, again, is everything outside of the brain and spinal cord. So it's going to include the sensory receptors, the peripheral nerves, the ganglia, the efferent fibers. So everything that's not brain and spinal cord. Now, our sensory receptors, they're going to pick up changes in the environment, right? A stimulus in the variable. We can pick up both internal issues and external issues. Each type of receptor is specific to a certain stimulus. This is why we have so many different types of receptors. If you're a heat receptor, you can only pick up heat. You can't pick up cold. You can't pick up touch or anything else. So we have lots of different things we can pick up. So we have lots of different types of receptors. Now, some terminologies. Receptor field, that is the area monitored by a receptor. It's like your front yard. Okay, so if you have a front yard, you mow it, you keep it clean. If somebody gets in it, you shoo them away. You can respond to anything going on in your front yard. You don't care about your neighbor because that's their yard. Now, with our receptor fields, the bigger the field, the less sensitive they are. Again, it's just like your yard. If you had a 6x6 square of grass, it's probably immaculate because you could probably go out and cut it with scissors if you got bored. If you have an acre front yard, if you've got a weed somewhere, you don't care because there's a whole bunch of field that you're having to deal with. So areas that have very small receptor fields are very sensitive, so we'll find those like on our hands. Areas that have very big receptor fields are not as sensitive. Again, it's one of the reasons why we can't pick up a lot of detailed stuff with our back. Very big receptor fields. Now, sensation versus perception, these terms are again often misused. So a sensation is when a receptor is sending information to the brain. So where you have information arriving at the central nervous system. So if you get touched, that receptor is going to send that signal to the spinal cord. That is a sensation. Now, perception is when we become consciously aware of it. So we have our receptor sending a sensation. Once it gets past the thalamus and the cerebrum goes, hey, somebody just touched me. Now we have a perception. Now, not every sensation will become a perception. Sometimes your thalamus will block stuff. So after a while, even though the sensations are still coming in, you may no longer perceive that. This is something that we might notice like when you wear underwear. Okay? You have underwear touching your skin everywhere your underwear happens to be. After a while, you don't feel your underwear anymore, even though that skin is still sending signals saying, hey, something's touching me. After a while, the thalamus is like, yes, we know we have underwear. Shut up about it. Okay, so it stops sending that to the cerebrum, so we no longer perceive the feeling of your underwear until I started talking about your underwear, and maybe now you feel your underwear. Okay, so sometimes we block those things. So they're just showing a couple of receptor fields. So if we landed here, this neuron would pick that up. Landed here, this neuron would pick it up. If you landed here, nobody would pick it up. Okay, so areas, if the sensory receptor fields don't overlap real well, you may have a hard time picking up where things are touching you. Okay, so sometimes the details get lost. All right. It is the 15th, so we'll stall here. Pick up with our complexity tomorrow. It'll be exciting. Pretend you're excited. Woo, I know, not as much fun as serial killers or apparently random abortion things. Go home, study the brain.